Leadership is not everybody who has done human resource management. There are some people, even with a salary, they have no job satisfaction. Not only in terms of remuneration, maybe because the working environment is not. It's also family ties. People can move because there are no good schools in that environment. Good schools are in town. Like now, with the crisis, there was rapid migration from the periphery to the cities. And we want to look into it. Security reasons to finances. People have abandoned their business, fruitful businesses in the periphery because of insecurity. Professional hospital, one already are people. Faith-based organization, exactly. You go to a health center, maybe it's a reverend sister or a reverend pastor who is the chief of the health facility. That type of a person maybe is not even trained.
Welcome back, Osbert, to the second part of our discussion. Can you share with us the differences in terms of managing staff when it comes to private and public hospitals?
Well, in private hospital, there is that slogan that they say, we'll hire and we can fire anytime. Most of these private hospitals are for business purposes. And for business, the key weapon there is profit. No profit, no growth. No profit, no salaries. So the problem there is no job security. We have the problem of job security. There's poor leadership. In the government, there is some sort of security. That's why everybody, like our setting in Cameroon, everybody is looking for a magic because they are sure that their job is secure, whether they are sick. But with the private, once you get sick, you cannot expect somebody's business to be sitting behind. After some time, they can give you a period of grace. After some time, you are summarily terminated. But in the government, it takes a very long procedure. So when people have their opportunities to shift to state-owned health facilities, you will see them coming in their numbers.
What is done in the private settings? Yes, we know most of them, they are for business purposes.
Yeah.
And sustainability for health institutions, you see, even in private settings, some of their projects are not sustained. Why? Because you train staff today, tomorrow they are departing. You train another person today, tomorrow the person departs. And that's how projects keep on failing in these systems. Like what is it that they do that cannot sustain the staffing in these systems?
It's clear. If you see, like the very state nurse that is trained in Chison has had his admission recruited by the state. Maybe he's being paid 200,000. Disparity in salaries. It's being paid 200,000 by the state. That very staff, because in the private sector, it's negotiation. That very staff maybe in another health facility will be paid with the same level of training. May be paid 50, 100,000, and is there. This type of staff have an opportunity to be recruited by the state. I think that nobody wants to remain on the same point. Definitely switch to take that opportunity. So that salary difference too is a big problem. Then, like I told you, leadership is not everybody who has done human resource management. There are some people, even with the salary, they have no job satisfaction. Not only in terms of remuneration, maybe because the working environment is not good.
What are some of those characteristics of poor working environment in some of these private settings that you think is kind of a pushing factor to most of the staff?
You go to a health facility, especially in the periphery, there is no electricity, maybe there's no good road to access that health facility, there's no structure even for the nurse or for the technician, poor accommodation. Maybe now we are living in a modern world where technology, IT technology is all over. There's no internet, but because he is bound to work in that type of environment, he will be bound to remain in that type of environment. But if he sees a greener pasture somewhere, even with money, he will want to live. There's also family ties. People can move because there are no good schools in that environment. Good schools are in town. Like now, with the crisis, there was rapid migration from the periphery to the cities. And we want to look into it. Security reasons to finances. People have abandoned their business, fruitful businesses in the periphery because of insecurity.
What are some of the attitudes you witness of leaders who work in private hospitals that makes the environment not comfortable for staff?
Recently, it's now that confessional hospital, one already are people. Faith-based organization, exactly. You go to a health center, maybe it's a reverend sister or a reverend pastor who is the chief of the health facility. That type of a person, maybe is not even trained. The technician will give a complaint, number one, number two, number three, if it is not provided. Do you think that that technician will be happy with the boss or will be happy with the patients? You want to live that type of environment. Most of their schools, go to school, it's even better with education. It's worse because in education, you can, in public health, you cause an error, it's difficult to reverse it. How do we do it? Well, they have their reasons. They might think that if they bring somebody who is not in the faith, they might mismanage their funds and they will not know how to account for it or accuse a person.
Yeah.
So that's a serious handicap that will happen. But recently, I see them being trained in many of these schools. It's something that they themselves have also discovered that they have to work on it.
And it's high time we begin to take care of our healthcare staff so that they can continue to deliver quality healthcare to our population. If our staff are not satisfied with the environment, they won't be able to provide quality care. If they are not motivated, they won't be able to take care of our patients. If they are not well paid, they won't be able to take care of our patients. So it's important that these factors are put into consideration to be able to motivate our staff. Once more, thank you very much. And yeah.